Evening, everyone. Hi. Great turnout. Thank you. So my name is Liz Krueger, and I'm the state senator here on the east side of Manhattan, and I'm delighted to see so many of you out here tonight. I want to start off with a couple of thank yous and announcements. One, I want to thank the CUNY Graduate Center for letting us use their fabulous facilities yet again. I have to tell you, I take advantage of the CUNY Graduate Center facilities frequently, and so I really do appreciate not only what they do for the students here of New York City, but also as being great community space. I want to thank our panelist speakers, which you'll be hearing from and learning more about as the evening unfolds. I want to thank our many co-sponsors, and I'm just going to read down quickly. Assemblymember Deborah Glick, who's here with us, National Institute for Reproductive Health, Planned Parenthood, Empire State Acts, Concerned Clergy for Choice, New York Civil Liberties Union, Planned Parenthood of New York City Action Fund, NARAL Pro-Choice America, National Organization for Women, New York City, American Congress of Obstetricians and Gynecologists, ACOG, Raising Women's Voices, New York Abortion Access Fund, the Center for the Study of Women and Society at CUNY Graduate Center, Physicians for Reproductive Health, Reproductive Health Access Project, New York State Association of Licensed Midwives, the National Council of Jewish Women, New York State, New York Indivisible, Eleanor's Legacy, Women's Health and Reproductive Rights Working Group of #GetOrganizedBK, Rally and Rise. So we have all right, yeah, everyone. You know, you think with such phenomenal groups, we wouldn't be going backwards in this country, but that's another discussion. You all should have a booklet with descriptions of all the co-sponsors and the event program with speakers' bios and instructions for how to log on to Wi-Fi here at the CUNY Graduate Center. Since I know many of you just can't not tweet, and we encourage you to, we're asking that you use for Twitter tonight, #RHA2018, #RHA2018. Index cards have been passed around, but you can wave your hand and a staff person will bring you another. Write down questions that you may have of any of the panelists, and then staff will pick them up during the course of the forum, and we have set about 20 to 25 minutes for question and answers at the end. We have an incredible panel of speakers who are going to discuss their advocacy work for the Reproductive Health Act and why it is so important, the Reproductive Health Act and its status in the state legislature, what getting an abortion was like before Roe v. Wade, as well as reproductive rights and justice since then, personal experience of people who had to leave New York State and travel to Colorado to get a late-term abortion due to their fetus not being viable and the challenges involved due to our bad current law here in New York, limits to abortion care in New York due to current law, and why it is important to have appropriate abortion laws for women and abortion providers. And again, we're going to have Q&A at the end, so write your questions down as we go along. The speakers' bios are all in your event program, but I'm very excited that you'll be able to hear from Deborah Glick, the 66th Assembly District Assembly member, who is the lead sponsor of the Reproductive Health Act in the Assembly, which has, of course, passed the Assembly. Martha Plimpton, who many of you recognize as an incredible actress, but I only recently learned that she's also an incredible activist for abortion rights and co-founder of the organization A is For. And you can check out aisfor.org afterwards or while you're listening. We have Katharine Bode. Katharine Bode, the Senior Policy Counsel for NYCLU, and even though I'm the lead sponsor in the Senate, a much better explainer of the bill than anyone else in the state of New York. We have Carol Sanger. Carol Sanger, who's the Barbara Aronstein Black Professor of Law at Columbia Law School and is also the author of a book about abortion. We have Erika. I should have said hold the applause to the end. It's too late. Now you just have to keep applauding after each one. We have Erika Christensen and Garin Marschall, who are patient advocates speaking out for others based on their own experience here in New York. And we have Dr. Treasure Walker, an MD and an MPH, Assistant Professor, Department of OB-GYN at the NYU School of Medicine. First, I would like to, and I forgot to tell everyone, you are welcome to speak from your seats, or if it's your style to like to stand up here, that's fine too. All these mics work. But our first speaker and guest is Assemblywoman Deborah Glick.
I'm going to stand. Undergraduate theater major, you want to keep your lungs expanded rather than compressed. So good evening to everybody. I'm very happy to be here, and thank you, Liz, for putting this together. Very important subject, our legislation, Reproductive Health Act. Let me preface my remarks on the bill itself by pointing out that throughout history, we see those who have fought for various basic rights, whether it was voting rights for women or people of color, or basic civil rights for the LGBT community. Those fighters were fervent in their efforts, which often took years of dedicated work, and they understand the great difficulty in achieving those wins and are committed to exercising those rights. Those who are distant from those battles become complacent, and in many instances take for granted those rights. They don't necessarily exercise those rights regularly and assume that they can never be rescinded. For years in Albany, the folks who participated in the annual lobbying for reproductive freedom, for example, attending the Planned Parenthood annual conference, generally were people of my generation or an older generation. Rarely did young women participate. They may be working, hard to take a day off from work to attend a conference, but this year was different. For the first time in memory, the women coming to a lobbying visit for reproductive rights were mostly women in their 30s. Yes. Clearly, the Trump presidency has galvanized women in particular and resulted in a renewed wave of young women determined to defend their rights to reproductive health choices, for which we are grateful. Energize your friends. My personal passion started as I was entering college, when abortion was illegal in New York State. A close friend, we were in our senior year at high school, she became pregnant, we had no idea of how to obtain an abortion, and she was disappeared by her family. A teenage pregnancy was a family shame, and she was sent away, put in an apartment somewhere in Brooklyn, far away from her friends and classmates in Queens. And though we reconnected years later, it was not a topic of discussion. It wasn't until recent years that I recalled an early and shocking experience when I was much younger. It was a deeply affecting news story that, when I think back, may have actually been the real genesis of my commitment to this issue. I grew up in Queens, and there was a local paper, the Long Island Press, which was delivered at home. And perhaps if it hadn't been, I might not have seen the story. It was 1962. The shocking details of this really horrific story left an indelible mark on my consciousness. It was the story of Dr. Lothringer. He was a physician who lived in Jamaica Estates, a nice, pricey neighborhood, not far from where I lived, not as pricey a neighborhood. And he was an abortionist on the side, obviously very sub rosa. Barbara Lofermenti was a 19-year-old college student who was pregnant. She was brought to the doctor by her mom, but her abortion went terribly wrong. The doctor told her mother that there were some minor complications, her mother should go home, he was going to take her to a local hospital for some oxygen, and he would contact her when her daughter was ready to go home. But Barbara had died. And because the abortion had gone wrong and it was illegal, and he panicked, there was no one he could call to get medical assistance for this young woman. And he had this problem. So this young woman and this panicked doctor and his receptionist cut up her body and put it in the plumbing, and he fled. It backed up the sewer, and she was discovered. I mean, the parents came looking for her, checked at the hospital, there was nobody there, and she was discovered. Now, this is the story that I read about when I was 12 years old. And it was seared into my memory. And the doctor and receptionist, they fled. They were discovered months later in Europe. They were brought back. He was charged with manslaughter, and he got 2 to 8 years. Now, there are more disturbing stories about his later endeavors after he retrieved his medical license. All the more shocking. But I have been motivated by the very simple reality that when abortion is illegal, women die. And that is what has been a driving factor in my life, my entire adult life, from the time I went to college, through New York changing its laws and Roe v. Wade. It has been an endless fight to protect women's right to control their own reproductive decisions. Now, for the bill, New York, many of you, I can see who's in the audience. I know many of you. It's nice to have you here. You know that abortion laws were changed in New York in 1970, which predated Roe v. Wade, and so there are inconsistencies between the state law and the federal protections. And when it was changed, the reality is that the laws were liberalized, but abortion still resides in the penal code, not in public health law. And that's what the bill does. It moves this into the public health section. It is also intended to update, because 1973, after all, was a long time ago, and there have been many changes. So there were a number of medical professions that are common today that didn't exist in 1973. So the bill, or 1970, so the bill updates our law to reflect that healthcare providers working within the lawful scope of their practice can perform abortions. It also leaves up to professional medical judgment whether a pregnancy is up to that 24 weeks or whether there is fetal viability. This is a medical decision, should be left to medical professionals and not to legislators who have never clapped an eye on the women who are involved in these situations. Furthermore, federal protections include protection for the health of the mother. New York State law does not. And so this bill would resolve that issue as well. So currently, the lack of this state protection for the health of the mother has led doctors in some situations where a mother's health is at risk, but not her life, to spend more time consulting with lawyers rather than with other medical personnel to determine what is the appropriate medical treatment to pursue. So the Assembly, controlled by Democrats, has passed the measure 3 or 4 times already, but as we know, it is stalled in the Senate, which is controlled by the Republicans, with the assistance of the independent Democrats. I'm so glad so many of you are up to date. So this is where elections matter, but follow-up is essential. So you elect Democrats, but you have to see that they live up to the principles of the democratic policies that we embrace. So the independent Democrats hide behind the smokescreen that all 8 of their members support choice, but ignore the fact that they can't get a vote on the bill, and the fact that the real Democrats include 22 members, I believe it's 22 members, who are in favor of the bill. So while we've always wanted to make New York state law consistent with federal protections afforded by Roe, it is now crucial that New York women are protected by state law, because we cannot depend on federal protections. And that is why it is inexcusable for the political machinations in the Senate by the independent Democrats continue to deny women their basic rights, and that must come to an end. Thank you.
Thank you very much, Deborah. And our next speaker is Martha Plimpton.
I'm going to stand too because I'm in show business and I'm used to it. Very theatrical type of person, so and you'll forgive my hoarse throat. I'm thrilled to be here, thrilled to have been invited to join you all and to join our Assembly member and our Senator, and extremely thankful to them for co-sponsoring this incredibly important legislation. I'm very grateful to our Assembly member for her leadership in helping get this passed in the Assembly. And now it's time to pressure everybody else to get it passed in general. New York State legalized abortion in 1970, which is, of course, before the Roe v. Wade decision, which guaranteed the constitutional right to abortion. It was 3 years before that decision. And we see now, in 2017, that actual practical access to abortion across the country is, in fact, much more limited than it even was at that time, even in 1970. 90% of counties nationwide lack an abortion provider at all. The majority of women of childbearing age in this country face enormous obstacles to accessing abortion care. 29 states, I believe, if I'm not mistaken, right now have fetal personhood, so-called, bills on their books, which prioritize the so-called protection of the fetus over the civil rights of the pregnant person. These are dark and dangerous times in our country in terms of the trend for abortion rights and access to abortion care. This Reproductive Health Act would accomplish the goal of basically removing restrictions that criminalize abortion, as you've already heard, by moving practice into the modern age, by allowing nurse practitioners and physician's assistants to provide abortion care, which would be great. And it should become law during this session. So that's why we're here. We're here to mobilize one another, energize one another, encourage one another to put pressure on our leaders to get this thing passed once and for all. So how do we make clear to those in our state government who are on the fence about this legislation, as the ones we were hearing about, that these protections are necessary to fulfilling our state's historic promise to the women of New York and to the citizens of our country at large? Do we let this slide, or are we, in fact, New Yorkers?
We're New Yorkers.
We're New Yorkers. I'm a New Yorker, born and raised. I grew up on the Upper West Side of Manhattan. I was born in 1970, the year that that our state legalized abortion. I'm proud to have the same birthday as that, or birth year. While I did not have my first abortion in New York, I did have my second one here. Yeah. I received care that was private. I was lucky enough to be able to afford private abortion care. And that was lucky. That's a lucky thing for me, and a fortunate thing, and a thing that I deserved, and a thing that I wanted, and I think that I'm very, very happy that I did. With voter turnout in this last mayoral and city council elections at near record lows, I think the number is somewhere around 21% of registered voters actually came to the polls this most recent election, this mayoral election. We're making ourselves very vulnerable to energized conservative voters who are not in any way invested in the health, security, and rights of their fellow citizens. And we have some shocking or upsetting things to look at when we look at what happened in this last presidential election as well. We can't take being a blue state or a blue city for granted when a neighborhood like the Lower East Side, which is about, I want to say 60% low income or public housing, when a neighborhood like that sees 24% of its registered occupants voting for Trump. That's on the Lower East Side. That was a shocking number for me to hear. So that's important for us to know about. It's important for us to know, my colleague and friend Ian Stearns lived on East 12th Street, and he looked up the numbers. How many people voted for Trump on East 12th between 1st and 2nd? 56 people on one block voted for Trump on a Lower East Side. I don't know how I'm going to sleep tonight knowing that number. So this is very important to understand. I mean, you can vote however you want, obviously. I prefer you to vote a certain way, but that's none of my business. But I think this is the reason I'm bringing this up is because there's a trend here, and that New Yorkers generally really consider themselves safe. And I think we have to recognize that with these kinds of demographic shifts in the electorate, and with this kind of energized voter on the right, we just can't afford to think that way anymore. We can't afford to think that just because we're an historically pro-choice state that we're going to stay that way. So we have to mobilize our historically progressive, diverse electorate, our neighbors, our families, our friends, our kids, our students, who are some of the most vocal and out front in the country right now. I mean, there was a concern for a time that young women weren't engaged, but as the Assembly member says, young women are really getting engaged in this, and we owe them a lot of support and attention and gratitude for their interest in this issue. Because the national trend is not good. We've lost enormous ground, and women and girls are suffering. With abortion services harder to obtain in this country than, as I mentioned, the years before Roe, with fully 7 states across the country having only one abortion clinic each. And as I mentioned, 90% of U.S. counties having none at all. This is a crisis situation. Abortion care is the most heavily restricted and legislated aspect of medical care in this country. That's a fact. Almost daily, we see efforts to work around Roe in the states and even in Congress with subterfuge and trap laws designed to undermine and close clinics and intentionally misleading and dangerous language being snuck into, for example, most recently, just this past week, the so-called tax reform bill that's currently being, hashed together by a cynical and deeply anti-woman GOP-controlled Congress that would establish an embryo as a protected person and the pregnant person stripped of their agency and fundamental right to bodily autonomy. They're relentless. It's almost every day these people are trying to do this. With constant attacks on the ACA, and particularly, and most successfully, they're winning attacks on the birth control mandate in the ACA, and these so-called religious liberty bills and workarounds that weaken access to affordable contraception and reproductive health. These abortion protections are more important than they've been in a generation. They've always been important, but the urgency is critical right now. We've seen also, I don't know if any of you read the recent LA Times article about the rising maternal mortality rate in this country. We have the highest maternal mortality rate in the developed world, in the United States of America. And infant mortality as well is on the rise. And even more terrifying is that this maternal mortality rate disproportionately affects Black women, women of color, immigrant women. Black women in Texas are dying at ridiculously astronomical rates from pregnancy complications, poor medical care, poor prenatal care, and lack of access to health care in general. So we're seeing a deadly threat become an actual deadly reality for thousands of our fellow citizens nationwide. It's not enough to pride ourselves as New Yorkers, which we tend to do. We're very proud people, and with good reason. We're brave, we're courageous, we're diverse, we're complicated, we're neurotic, we're curious, we got energy, and we put up with a lot. It's not easy to live in this city or this state. We have to take these national trends really seriously, and we have to act and provide a model to our neighbors. We have to take the lead here, again, in protecting women's health rights and their safety. The aims of this bill are comprehensive, but one of the most, that's already been touched on, one of the most important assurances that it would make to women is to remove this language placing abortion in this criminal code framework to one of public health and civil rights. This is crucial. Our organization that I helped co-found in 2012 after the horrific treatment of Sandra Fluke during the ACA hearings is organized around the guiding principle that abortion is not a crime and that stigma is our greatest foe. Stigma is the central issue in fighting this kind of attack on our civil and physical rights. 1 in 3 women will have an abortion in her lifetime. Abortion is more common than root canal. It's more common than homosexuality. And it remains, for most women, a subject of shame, isolation, fear. We can, in its own way, we can say that there's an abortion closet, and most women are in it. Because of the stigma and the shame and the isolation, and these sort of moral objections to a woman having the right to control her own body, which of course we know are utterly immoral. We have to note that safe and legal abortion is truly safer than even getting a colonoscopy. It's more dangerous to get a colonoscopy than to get a safe and legal abortion. By placing abortion care in a public health framework consistently, unequivocally, and once and for all, we can establish that foundation that we need to establish for dismantling this culture of stigma, shame, and discrimination that is around the most common and necessary aspect of medicine in women's lives, and that is subjected unfairly to this kind of, misinformation and all of this. Mobilizing and educating our electorate and our neighbors about the dangerous realities that we're facing is critical. Talking to your neighbors, organizing coffees or cocktail parties. Really, this is, going online, downloading whatever information you can from these people and sharing it with people. This is critical. We have to get these numbers up, these voter numbers up for 2018, but we also have to pressure our state government to do something about it. Fighting voter apathy is critical. And in that way, we can continue as New Yorkers to the country and to the world that New York is the leader on women's civil reproductive health rights. Thank you so much. Appreciate it.
Okay. As I bring up Katharine Bode, I just want to highlight again, if you think you have questions, index cards, write the questions down, we'll collect them from you. I also feel like I skipped a really important point in the beginning that both Deborah Glick and Martha Plimpton pointed out. So we have this bill that passed the Assembly, but in New York State, you needed to pass both houses. You need the Senate as well as the Assembly, and then the governor to sign it. And it's true, while Democrats have now a numerical majority in the Senate, we don't control the House because the majority leader is John Flanagan, an anti-choice Republican. He won't bring the RHA bill to the floor for a vote. We need a Democratic majority leader to bring the bill to the floor for a vote. The dilemma is because we now have 8 Democrats who are the IDC and 1 Democrat who's just joined the Republican, Senator Felder, we have too many people supporting Republican control of the Senate. So the tie-in between the IDC, and many people hissed, so they got the point already, but I just wanted to clarify our mission. And tonight, when you go through the tables of all the great groups who are here, everyone has action steps we're asking people to participate in. The mission is to get this bill to the floor. If John Flanagan wants to bring the bill to the floor as a Senate Republican, that's fine. It's actually not supposed to be a partisan issue anyway. Reproductive health didn't start out as a partisan issue in this country, and it's incredibly dangerous that it's become one. So if he wants to bring it to the floor, great. But I suspect he doesn't and won't. But in fact, if Democrats acted like Democrats, and then if we had more Democrats in the Senate, I know this bill would come to the floor and would pass. So I just wanted to put it in that context because I'm not sure everyone here knew that story. I'd like to bring up Katharine Bode from the New York Civil Liberties Union next. Oh. Good? Yeah, a little closer. People don't usually complain about my
Is it on?
Oh, there we go. There we go. Okay, I said some really funny jokes that the people in the back missed. Sorry about that. So my name's Katharine Bodde. I'm an attorney with the New York ACLU. I want to thank everyone for coming tonight. I also want to thank the senator and her staff for so diligently putting this event together. It is so important that we come together in community to talk about abortion rights, access to abortion, and how access to abortion fits into our larger mission to dismantle patriarchy. So certainly silence has allowed abortion stigma and misinformation to fester, to grow in this country. And over the past 50 years, we've seen how women's bodies, women's agency, women's futures have been politicized in really the most infuriating ways. But injecting abortion into our political system cuts two ways. And while it often means that opponents use our political system to chip away at our rights, it also means that it is so incumbent upon us to push back and advance these rights and plant these rights and values firmly in our political system and the rules that govern our communities, and understand that these rights are interconnected to our larger struggle to free women and to free men. So my part of today, which I think I share with my fellow panelists, is to talk about what the fight looks like in New York and why it's so important that New Yorkers come together to educate each other and ensure that our abortion law actually reflects our vision and our values. So to understand how to move forward, we need to understand where we've been. As my fellow panelists have said, right now, New York regulates abortion in the criminal code. Like all other states in the country, New York criminalized abortion completely around the mid-19th century, except for, of course, in cases when a woman's life was at risk. But it took over 100 years for the people in New York to start questioning that decision, to start challenging that decision. And so in the 50s and 60s, we saw various groups come together. We saw the environmentalists come together with the public health folks, come together with the sexual freedom advocates, and finally the feminists joined the mix. And those folks put enough pressure on our New York policymakers so that New York became the first state to allow for legal abortion. Asterisk there, Hawaii was actually the first state, but they had an in-state residency requirement. Plus, I've never been to Hawaii. And an interesting story, the law actually almost didn't pass in the Assembly, but for a really dramatic change of events where a Democratic lawmaker from upstate changed his no vote to a yes vote. It's really an amazing story. Look it up. And so in 1970, 3 years before Roe v. Wade, the New York legislature reformed New York law. And how we reformed the law was to create an exception, to carve out an exception to the crime of abortion to allow for what's known as justifiable abortion. And so New York right now defines justifiable abortion as an exception in our homicide code and as abortions that are performed by a physician within 24 weeks from the commencement of pregnancy and after that point when a woman's life is at risk. So I want to zero in on a few parts of that law in particular that create barriers to accessing abortion in New York. But before I do so, it's important to understand what happened 3 years later. In 1973, the Supreme Court decided Roe v. Wade. And although the standard and the framework in Roe has certainly shifted over time, and much to our chagrin in certain cases, some of the core principles remain the same. Among other things, Roe stands for the principle that states may not prohibit abortion throughout pregnancy when a fetus is not viable, when a woman's health is at risk, and when a woman's life is at risk. And so the first thing I want to zoom in on is the explicit conflict between Roe v. Wade and our abortion law. So our law does not expressly allow for care later in pregnancy when a woman's health is at risk or when there's some kind of fetal diagnosis that is incompatible with life. And even though the guarantees and protections of our federal constitution override state law, doctors in New York State won't provide this type of care. And they won't provide this type of care because, number one, abortion is in the criminal code. So the general counsel at hospitals are not going to allow that type of care to go through. And on top of that, we're dealing with a society that deeply stigmatizes abortion. So what that means is that women are being sent out of state, and being sent out of state in their hour of need, on their own bill, and the cost of that, both financially and emotionally, is just plain wrong, if not cruel. And Erika and Garin, I've been lucky enough, along with my colleagues, have been lucky enough to work with Erika and Garin, who are going to tell their story in a few minutes about how this piece of our law particularly impacted them. So the second thing I want to zero in on is the physician language. So at the time the law passed in 1970, physicians were allowed to practice medicine according to the education law, and we're really the only types of practitioners within the education law. So the law references physicians because the whole point of the law was to make abortion more safe, to bring it into the medical context. But zoom forward almost 50 years, and the delivery of healthcare looks very different than it did in 1970. And that means that we have different types of healthcare practitioners, those that are licensed and trained to prescribe and provide early abortion care. And even though we have an Attorney General letter in the state of New York that interprets New York law to allow nurse practitioners, physician's assistants, certified midwives to provide abortion care, the criminal code is an intimidating code. And these practitioners don't feel comfortable providing this type of care, especially where it's most needed in upstate New York. And this is a huge access issue, especially for women who are historically disconnected to the medical system. And I'm speaking about rural women, I'm speaking about low-income women, and I'm speaking about women of color. Third, and this is something that isn't always part of our talking points around the law, but it's so important that everyone in this room understands this. Ramifications of our abortion law are not limited to abortion. These things are all connected to a much larger web of rules that seek to control pregnant women and punish pregnant women for behavior during pregnancy that results in a bad outcome. So courts in New York are justifying punishing pregnant women in other situations based on the existence of our abortion law in the penal code. And I'll give you two examples, but the list goes on. So for instance, there was a hospital out on Staten Island that found that overrode a woman's refusal of a C-section. So they performed a C-section on this woman over her refusals, and the court did not find malpractice and cited to the fact that New York criminalizes abortion later in pregnancy. Forced medical treatment. So another case, a pregnant woman driving out on Long Island, crosses the center line, gets into an accident, is rushed to the hospital, consents to a C-section, the baby is born and dies a few days later, and the local DA decides to charge her with homicide. This case goes all the way up to our Court of Appeals, our highest court in New York State. And even though the Court of Appeals in New York State overturned her conviction, the dissent in that case cited to the abortion law as justification for why the state should be able to punish pregnant women for behavior during pregnancy. So this is a pattern we're seeing across the country. And if anyone is following the direction of our courts, that our courts are taking in this country, this is cause for very deep concern. So we have to fix our law. So I'll just mention briefly, as the other panelists have, we have to pass the Reproductive Health Act. And the Reproductive Health Act primarily does three things. Number one, it removes the regulation of abortion completely from our criminal code and puts it into our public health law. Abortion is not a crime.
Yeah.
Second, it reflects constitutional protections so that women can access care when they need it. And the last thing, importantly, that it does is it allows for licensed, trained, competent medical professionals to provide abortion care within their scope of practice. So it is certainly past time that we decriminalized women's bodies in New York State. But certainly given who is at the top of the pile these days, it is so incumbent on New York to lead the rest of the nation in this conversation, because there are other states that would lead us directly over the cliff in the other direction, and we cannot let that happen. So I started off thanking the senator and her staff for creating this space, and I implore you to do the same and to carry this word and these actions forward. Thanks.
Thank you, Katharine. Our next speaker is Professor Carol Sanger.
Well, I join the others in thanking you for being here. And some of what I want to say has been said, so I'm sifting through it to pick out bits that haven't been said or that will interest you particularly. So, and if I'm saying something that you know, just shout out, turn the page, or we know that, and I'll act accordingly. So, as you know, in January of 1973, the Supreme Court held that a woman's right to choose abortion was protected under the U.S. Constitution. This meant, as has been said, that the states could no longer make it a crime, which leads to where the location of our law is, as 29 of them did at that time. Now, the decision was widely celebrated by physicians and pro-choice women and women who didn't quite know they were pro-choice because they hadn't yet been faced with a pregnancy that was a calamity. But women in New York, trendsetters that we are, had celebrated 3 years earlier, so which you've heard about. So I'm going to talk in my remarks, I've been asked to talk about abortion law at 3 different points. So I've figured out how to phrase this. Before Roe, after Roe, and during Trump. And the reason I decided, I had after Trump, and then I decided, no, that was after the election, but we have to put during because it means there's going to be an end to this. So it's a time limited. And in talking about him first, or him and Pence, we must remember that Vice President Pence made it very clear, pledged repeatedly during the campaign, that he would, quote, consign Roe to the ash heap of history where it belongs. So let's just keep that forefront in what we're thinking about. And since the inauguration, the administration has been stocking the Department of Health and Human Services, as well as the federal bench, with people who are staunch, newly invigorated, pro-life backers. And about a month ago, and I was waiting, people kept saying, well, you know, when are they going to start in on abortion? I said, just wait. And so I figured as soon as they had thoroughly wrecked the environment and then moved on to wreck our national immigration policy, they were ready for abortion. They were ready for women's health and contraceptives. So in the last month, we've seen a lot of activity against abortion, contraception, but do recall that we've already had 2 little announcements by our president about this. His suggestion that women who have abortions, punish them. I don't know if you remember that from the campaign. And also from the debates. And then the day before the baby is going to be born, they cut the woman open and they rip it out. And I was on a panel last week with some physicians, and they said, actually, we study that in medical school. It's called a cesarean. So New York has been in the forefront of criminal abortion law reform during the 60s, ending up with our early decriminalization. And it's crucial that we remain that way with like-minded sister states in order to resist what's coming. Now, let me just start with some quick comments on the Pre Roe period, because there's some interesting things about how abortion practices went then. And I think it's useful to think of how the system thought about women, and physicians then thought about women in terms of thinking out what we should be alert to now. We know that there was in New York, starting in the 1950s, New York shifted to what were called hospital abortion committees. And so in order to, you could get an abortion as long as you had a therapeutic reason. And I want to note here, having to give a reason for why you want the abortion runs smack into states who are now requiring women to give reasons, or saying that if you are having an abortion for the reason of avoiding a child with a fetal anomaly, or that you don't like the sex of the baby, or you don't like the race of the baby, you are going to be prosecuted under the Americans Against Discrimination Act. We now have PRENDA, the Prenatal Discrimination Act, and again, as sex discrimination. So giving reasons is dangerous territory. Nonetheless, if you say that if the mother's life is at stake, so that then you could have a therapeutic abortion. However, some women's lives, their bodily lives, were not at stake. It was just their regular lives were at stake. Their living lives were at stake. And so it became possible to get a therapeutic abortion if you felt that your life with this unwanted pregnancy and involuntary motherhood was so terrible that you were going to kill yourself. Then you could get permission to have an abortion. And I'll say that I remember when I first started working on this, I was teaching in California, and a student who was older than most I asked her to help me. And I said, why are you so interested in this? She said, I came home from high school, when I was in high school, this for her, in the 60s. And she said, my mother was sitting on her bed weeping. And I said, what's wrong, what's wrong? She said, I had to testify today before 5 doctors that I was crazy, and I'm not crazy. And so it's what law makes women do that we should keep in mind and stay away from things like that. So these hospital committees, in order to get an abortion because you were going to kill yourself, which is how the law is set up now in Ireland, who are having a referendum on this, and we certainly don't want to be behind Ireland in reproductive rights. You had to testify, and doctors initially granted these. Alan Guttmacher, with his famous Guttmacher Institute, was one of the men who set up these committees, in part to keep the burden of the decision off any particular doctor. So it was like to share the decision making, to share the guilt or the blame which might come about in case somebody was prosecuted, and you had so you had to go before a psychiatrist, and the psychiatrist was very crucial if you were saying you were going to kill yourself. And so they were granted pretty much. Then over time, they decided that too many were being granted. The doctors were being too sympathetic, and that they set quotas at about 1% of the number that would come in, was how many each hospital would give. And the other part of it, so there's the quota system, and then there's how doctors decided they were being misled by patients, by these women who were coming in. They said, the physician must have a high degree of suspicion for the patient who tries to pull a fast one. The source of danger was the individual woman seeking to satisfy her selfish needs. And there were many cases where they rejected women because they decided that the woman was just lying. She really wasn't going to kill herself, and her life wasn't going to be that bad. And so they would just turn her down. As one doctor said, the fewer abortions, the better our hospital looks. So this was the hospital system. And when Roe was decided, there was a companion case decided at the same time that said that's unconstitutional. The decision is for the woman herself in consultation with her doctor, and not a committee of 5 other people who aren't even her doctors, but no one else, just the woman in consultation with her doctor. Now, I wanted to just go back to say that when, prior to Roe, last point of prior to Roe, the New York became a destination for women seeking abortions when it was impossible to do so in their own state for that 3 years while we were still legal. And many women came to New York because we didn't have the residency requirement that Katharine mentioned they had in Hawaii. Wisconsin had it, one other state had it. And so you could be an out-of-state resident and come here. And one of the consequences for Roe, for New York, was the number of abortions plummeted because women were now able to have abortions closer to home and they didn't need to travel. We're certainly, so that's why New York was seen as sort of a beacon. It was a place where you could go, and some of you may participate in the underground railways that exist now to bring women who can't afford it to New York, or girls who are trying to avoid judicial bypass or when they can't get their parents' permission. Now, talked about the hospital committees, and then we come to Roe, which you all know, and so that was very well explained by Katharine, but I wanted to say that in my mind, Roe is almost overruled already, because we have to jump ahead 20 years to a case called Planned Parenthood versus Casey, 1992, where the court, what's the expression? She doth protest too much. Yeah, the court says, we are not overturning Roe. No, 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 we are not overturning Roe. We are holding to Roe's core concept. The core concept, according to the court, was that it can't be made a crime. Okay, but they changed a lot else, and they said, well, we used to have this trimester period where in the first 12 weeks, basically there could be very few regulations could be enacted. In the middle, where abortion gets more complicated, regulations for the maternal health could be acted, and after viability, no abortions at all. And they also said, so they got rid of that and said, the state has an interest in potential life from the moment of conception. All right, so this meant that the state could work on women, pass laws that were meant to persuade women against abortion from the very beginning. And I think that sometimes New Yorkers don't know what women in other states face. We read about it, but it's worth scaring ourselves a little bit. And I am one who believes that, well, I bet we all do, that the law is very key to how women feel about themselves. It's not just a religious issue that makes women feel guilty. Part of the argument I make in the book that you mentioned was that to the extent women feel guilty or reticent to talk about their abortions, or shamed that they had it or even thought about having one, I think women would be very heartened to know that there's a dense structure of law and culture that is organized to bring about exactly that result. And my view is that the states who pass these trap laws and others, they know they can't make it criminal. They can't keep you from getting an abortion, but they can make it as hard as possible. Hard financially, hard emotionally, hard practically, and hard legally. So it is a sort of, I don't remember what word you used, a camouflage of anti-abortion regulations coming in under pro-fetal regulations and pro-women regulations, because we all know that women are too stupid to know what they're doing when they have an abortion, and this is why we have to make them have an ultrasound and look at the scan. And in many states, the doctors have a script that was drafted by legislators, and where they have to point out the skull, the extremities, and what is often called the heartbeat, although the doctors I was with last week said it's not a heart. At 6 weeks, you do hear a sound, but it's not a heartbeat, it's a vibration, they said. So anyway, I'm still investigating that. I'm not a doctor, but we see that there's no constraints by the other side at all on making fetal life, prenatal life, as human as possible in as many ways as possible, so that we're sort of acculturated into it. And we saw this last week during the terrible shootings in the church in Texas. Yes? Yes, in Texas. And I noticed when I was reading one of the articles on them, which were all dreadful, that they upped the number of victims to 26 from what had been listed as 25 because one of the women was pregnant. And so I mentioned to my husband, I said, I'm just noticing this. And he said, do you want to write about it? I said, no, I don't want to write about it. In the midst of a tragedy, in the midst of people suffering, mourners should call their people what they want. Then the next day, the New York Times called me up. A woman says, we'd like to interview you about the Texas church shootings. So I just said, And she says, you know why I called? I said, of course I know why you called. And what I tried to say to her, and I say to you, was, there are things we have to keep in mind, differences between wanted pregnancies and unwanted pregnancies, and how much of what the right does is take rituals that apply to wanted pregnancies, like burying, which now Texas has a burial of you have to bury or cremate fetal remains, or calling someone a victim, or a person, and that we have to separate out the purpose for which it's being done and whether it's the government doing it or not. That's what we care about, what the government is making us do. So I have. Sorry? Yeah, no, you're not. You can. I thought she told me I had 15 minutes. No, I didn't. She told me. And I worked very hard. So you may, of course, you may cut me off.
I'm sorry. I'm the bad guy. And I am the bad guy. But we have so many incredible speakers, and
I'm sorry.
No, it's not you. Everybody else, we all started a little late. We all got a little longer and longer. So I think that Joanne Simon from the Assembly snuck in here before. Oh, hi, Joanne. And I want to, like Deborah Glick, Joanne is one of our real heroines in the Assembly, and she came all the way from Brooklyn. So thank you so much for coming to Manhattan. Reminder, write down questions you may have on cards and just wave them in the air and somebody will come and get them from you. Our next speakers are two phenomenal people who are a husband and wife team who, I'm sure they will explain this, they never really planned on being leaders in the right to abortion movement. It was sort of thrown at them, so to speak. But I first met them when they came to Albany to talk about their own personal experience and learning how bad the law was in New York State for them. And they have been going out and speaking to legislators, to organizations throughout New York State, and encouraging other people who have had similar experience to write their stories or tell their stories. And going back to a theme of tonight, we can't let the stigma that is attached to abortion to stop us from ensuring that everyone in this country has the right to make their own decisions and not let, nothing personal for all the men here are here, because obviously if you're here and you're male, you're fabulous, but we can't let men in elected office be making the decisions about our lives, our health, our reproductive rights. So I'd like to bring up Erika, Christensen, and Garin, Marschall.
A 42-year-old woman on the Upper West Side who has spent thousands of dollars to get pregnant in the first place goes to Maryland to terminate one twin at 29 weeks to save the life of the other. A mother in Mineola finds out her second baby has a condition that would translate to a constant vegetative state for their child if they carried to term. A young Muslim woman from Brooklyn finds out at 30 weeks that her baby's neurological issues are so severe she might never develop brain function beyond that of a 6-month-old child. So she flies to Colorado almost exactly a year after we did. These are a few of the dozens of women I've met over the past 18 months since I terminated a pregnancy at 32 weeks. While each story is unique, we've all ended very wanted pregnancies. We share a particular grief that places us in a rare kind of sisterhood. These are complicated decisions made with our doctors and families to mitigate suffering, always. And for those of us from New York, our grief was compounded by being made to feel like criminals.
The laws that we make say a lot about who we are. They codify our principles and our morality and hopefully our wisdom. But ultimately, our laws are products of our shared experiences, our stories. Something terrible happens, we tell each other, we all agree there should be a law governing it, and make sure it doesn't happen again. But if we never hear some of those stories, if they're stifled by shame and stigma, they never get woven into the DNA of our laws. The terrible thing just keeps happening over and over again. So every law has a why, right? Why do we need this law? Who does it affect? And the why is critical to getting people on board because people tend to make political decisions with their emotions, with their hearts, not their intellect. Look at 2016. The Reproductive Health Act allows for the lives of people, the circumstances of their pregnancy, to matter and to determine the course of their care. And these stories are why we need this bill.
When we first went to Albany and started to tell our story in the offices of senators opposing the RHA, a couple of things became clear to us fairly quickly. Even though these people empathized with our situation, they didn't grasp that this was an issue that was affecting patients across the state. And even if they personally wanted to help people like us, they felt they couldn't publicly support the RHA because there would be political ramifications with their party and with their constituents. So think about that for a second. We tell them our story, and everyone in the room agrees that there's a problem. But they say their constituents wouldn't understand. The implication then is that their constituents are dumber or less compassionate than they are. We obviously strongly disagree. We see this as an educational problem, not necessarily an ideological one. We believe that we have to reach out across the state so that our fellow citizens understand the need for this bill on a human level. And once New Yorkers understand the need, the why, we think they'll start pressing their politicians on this, asking how they are allowing these tragic situations to keep happening. We want to create a tipping point where our representatives will see it as a political liability not to support the RHA. Our small role in this is to tell you our story.
So this is our story. E and I met while working at a scrappy political theater in the city. We actually do have a theater background. We were friends for years before the timing was right, but once it was, it felt inevitable and kind of easy, actually. And once you find your person, you can't really imagine doing anything without them. But one night we were in bed watching TV, and Erika started mumbling gibberish. And suddenly her face contorted, and her body froze in a grotesque and painful position, and I was terrified. I frantically called an ambulance. They struggled to get an IV into her. It's really scary to see an FDNY paramedic look nervous. I'll say that. It was a full-blown seizure out of nowhere. And people just don't have seizures out of nowhere. And eventually, she would require brain surgery. But after that night, everything was different. And it felt like nothing would ever be taken for granted. Erika proposed to me soon after that. And we... Yeah. We got married, and eventually Erika peed on a plastic stick, and it said she was pregnant. And we were excited and hopeful. At 10 weeks, we went in for a routine ultrasound, and the OB was chatting away, and then she just stopped and said, "I'm sorry." There was no heartbeat. It felt like I got kicked in the stomach, and we were devastated.
So we cautiously entered into our next pregnancy. It's kind of like your second real romantic relationship. You enter into it hopeful, but your eyes are open this time, and the innocence is gone. And maybe that's why, as complications started to stack up, we remained hopeful. Reticent to give the baby a real name, we referred to him as Spartacus, our little fighter. A woman I know who leads our grief group talks about how pregnancies run on hope, that it's as essential as amniotic fluid. And maybe we had too much hope, pushing past all of these complications that, in hindsight, were signs of a doomed pregnancy. Ironically, the first definitive indication that this pregnancy was not viable was an excess of amniotic fluid. The baby couldn't swallow, which meant that the baby couldn't breathe. The doctor explained that if I carried the pregnancy to term, and if the baby made it that far, the baby would choke for breath and die in his only moments of life. I was 30 weeks pregnant and just finding that our pregnancy was not viable.
Now, New York didn't doom our pregnancy, but everything that happened after that moment is why we need the RHA. Instead of our doctors plotting a course of care that prioritized Erika's safety and health, they were talking about how to work around the New York state law. We had two options. We could continue the pregnancy, condemning Erika to carry it for another 10 weeks or so without hope, and ensure the baby would die choking for air. Or we could leave the state and pay a doctor we didn't know to terminate the pregnancy. That's the real outcome of the current law. But there's no political liability for that. No state senator has had to go home to a town hall to explain the choice we had to make to their constituents, yet.
Once we received that final diagnosis, we never hesitated. We didn't know what was involved, but we knew we were going to get a termination because to us, it felt like we were minimizing suffering. Our doctor recommended a clinic in Colorado with a doctor named Warren Hearn. Patients that he had sent there had had good outcomes and had gone on to have successful pregnancies afterward. The 3 clinics in the country that do this procedure for patients out of state don't take insurance because they don't get reimbursed. So you have to pay up front. For a procedure like mine, that late, it is usually $20,000 to $25,000. I actually know people who paid $30,000. We paid $10,000 because Dr. Hearn only felt comfortable performing part of the procedure in his clinic. So the brain surgery, it meant that I couldn't push. So he and my neurosurgeon and my OB in New York had to coordinate a plan that included me flying to Colorado, getting a shot to stop the baby's heart, and then fly back that same night to deliver in a hospital here in New York in case something went wrong with my head. The delivery itself took 30 hours.
We had always wanted to go to Colorado. We always liked traveling. It's kind of what we do for fun. We actually enjoy being in a cheap motel in a strange city, but this wasn't fun. First of all, Erika is, at this point, 32 weeks pregnant. If TSA stops you because you aren't supposed to fly that late in pregnancy, the clinic advises that you explain you're 6 months pregnant with twins. But then, because apparently pregnancy is some sort of public invitation for strangers to invade your personal space and ask you questions, everyone in the airport, in the rental car center, everyone wants to know when she's due. If we know the sex, if we have a name, if it's our first. And because it's a few days after Mother's Day, everyone wants to wish Erika a happy Mother's Day. Then there's the money. We were fortunate and could afford to drop everything, travel to Colorado, rent a car, rent a hotel room, and pay $10,000 for the procedure thanks to Erika's mom's retirement account. But many people in this state can't do any of that. Many people are just forced to carry that pregnancy.
But beyond the hardships, beyond the costs of the procedure and the travel, the cruelty of the current law is that it compounded our grief with shame. New York didn't create the stigma around abortion, but it sure as hell is perpetuating it. My good friend assumed I was doing something shady when I told him I had to go to Colorado and pay cash, as if I was getting some sketchy back alley procedure, and in a way, I was. It is literally outlawed. So the current law draws an arbitrary line in the sand. Before 24 weeks, it's kind of okay. After 24 weeks, it's criminal. You're wrong, you're indecent, you're unworthy of care. Your health doesn't matter, shame on you. The shame makes us whisper abortion in hushed tones or use a euphemism like lost the baby. But whether you terminate at 8 weeks or 28 weeks, whether you terminate because of your health or a fetal anomaly or because you don't want to be a parent or because it's none of our business, you had an abortion. I had an abortion at 32 weeks, and I should have been able to have my abortion a mile from my house, not 1,800 painful, expensive, shameful miles away.
So now you know us. You know our story, but we want to stress that we believe this bill can happen. People tend to think change happens slowly, linearly, maybe generation by generation as views on issues like this evolve slowly. But that's not actually true. Change happens quickly these days. Ideas, stories spread like a virus, each host infecting a handful of others. Look at the Me Too campaign, where stories are being shared and we're dragging a bunch of powerful sexual predators out into the light. Advocacy campaigns, like pregnancies, run on hope.
So use our story or someone else's. Use it to fuel your own advocacy for this bill, and use it to talk to your fellow New Yorkers about why we need the Reproductive Health Act. At the very least, why it deserves to be brought to the floor for a vote. I can't afford to be cynical. And the next woman, blissfully unaware that she's about to be forced to carry a doomed pregnancy by the state of New York, can't afford for you to be cynical either. Thank you.
Our last speaker before we get to questions and answers is Dr. Treasure Walker. You know, I've heard people talk about being providers at abortion clinics and how nobody ever comes to visit them, nobody ever comes to say thank you. They get the protesters and the death threats and the state after state, the new demands on them as providers. So I thought it was particularly important to have a doctor here who could talk about what it actually means to be a provider and some of the issues that the healthcare professionals face because we don't have the right laws. So welcome up Dr. Treasure Walker.
Good evening, everyone. Thank you for inviting me to speak today. So my name is Treasure Walker. I'm an OBGYN and family planning specialist. That means I'm an OBGYN and I perform abortions. So I'm a medical doctor, trained to perform care for women of all reproductive ages, those who choose to be pregnant, who don't choose to be pregnant, who can't get pregnant ever. My specialty training is in family planning, so that's focused on contraception, abortion, reproductive health care as it relates to those entities. I knew I wanted to be an OBGYN for a long time, since I was about 12. And I thought, oh my gosh, my aunt's pregnant, IVF, that's so cool, I'll deliver babies, it'll be like the best thing ever. And most of the time it is the best thing ever, but not so much only because of the delivering babies, but because of the care that I provide for women every day. The family planning part came to me a bit later. Didn't really know that, that was like a separate specialty that one could do. Just thought it was something that OBGYNs did. You do contraception, you do abortion, that's what you do. And of course now I know that it's not just limited to OBGYNs and a lot of family medicine docs, surgeons, anyone can perform an abortion. And we need these folks to be able to do these things. So, I imagine, there are a lot of people who are involved in various aspects of reproductive health, from care provision to policy, and I imagine that's why many of you are here tonight to help us to get this Reproductive Health Act passed, and you're here to learn more about it. As each of us can make an impact. You've heard from everybody today, and I've heard a lot of things that I learned new too, having been involved in this for such a short period of time. So from my perspective as a clinician, what is abortion care like? What can this law do for us? Throughout my training, I'm seeing probably a few hundreds of women seeking termination of pregnancy for whatever reasons. Patients are at all ends of the reproductive age spectrum, so younger and older, different financial, socioeconomic, religious, cultural backgrounds. And specifically as it returns to age, I've taken care of a few very young patients who have found themselves pregnant, in my experience, not by choice. Luckily they had parents who were supportive to bring them to get terminations of pregnancy. But there are some places in this country where your parents may not support that choice. your parents or someone who's taking care of you has violated you and you can't go to them for support. And as was mentioned, patients need judicial bypass. Luckily in New York, that's not something we really struggle with on a day-to-day basis. So, you know, that's one of the lucky parts about practicing in New York is that, you know, we don't have those aspects of it, but that's also New York City, right? So we have upstate, and then there's New York City, as I understand it. I'm not a New Yorker natively. And, you know, in doing this work and having colleagues that are practicing all over the country, the women of New York City do have special access that other women don't have. And even though there are still other restrictions, as we've just heard about, there are some benefits, but those are only, you know, tenuously held in place, as we've heard, because the folks in Washington, i.e. the president and other people, are trying to really rescind that access. So I've taken care of women who have come from out of state. Right? Women come from out of state to New York most of the time due to gestational age limitations, especially from the South. I took care of a woman 3 weeks ago who had to come up here, find a place to stay, find someone to take her to her appointments so she could get her termination. It was a multiple-day procedure for her, unfortunately. And taking care of women as close by as Pennsylvania, which has a gestational age limitation. And, you know, when patients discover that they're pregnant at a later time in pregnancy, or when the pregnancy is complicated by an abnormality, or any change that occurs in their life that makes continuing pregnancy not an answer, it's a hard decision for them to make, to terminate. And I'm happy and proud to be with them in trying to help them make that decision. But it's also very difficult, always. But this should be a decision that the patient, her family, whoever her support persons are, make. Not that, you know, some senator, some assembly person or president or otherwise gets to have any input or influence on. These are very personal and private decisions, and to invade that space is a violation. Most of the patients I take care of, they're already parents, trying to do what's best for their families. They hold jobs, they go to school, they care for aging parents, they're still trying to pursue their dreams. Last week, I took care of a woman who had an early medication abortion because she didn't want to have any children with her current partner, who happens to also be abusive, but she's not quite ready to leave that situation yet. And the medical care that they need and that I provide is not criminal, it's medical care. The same as other medical services that we provide to everyone else. Abortion must remain accessible to all those who need it, not just to those who can afford it or have a certain amount of celebrity or power, but to all of us. I practice I practice in a hospital setting. Actually, I practice at Bellevue, which did have abortion committees and all that back in the day, in the bad old days, as we like to call it, to determine who got the abortion and who didn't. And, you know, it's an interesting place to practice. It's a public system. It's historic. It's large. And the patients that I take care of are coming from underinsured, no insurance, patients who, you know, come from out of state, come from out of the country, seeking care. And I'm proud that I am able to provide them with the services that they need. There have been a few women that I haven't been able to help, and we have referred them sometimes to Dr. Hearn, sometimes to Dr. Carhart, sometimes to Dr. Bode, out of state. And those three providers are pretty much it for patients, as was mentioned earlier, who are beyond the gestational age that the law allows here. And you know, for some patients that I am able to take care of, you know, in the city we have an abundance of providers, sort of, who are skilled in performing the abortion procedure to its gestational age limits, which can be more complicated as it goes forward. But in other parts of the state, that's not the case. I've taken care of a number of patients who have come from upstate saying that they were given an abortion pill, they thought that it worked, when in reality they were given lies or sent to other clinics where they tried to convince the patient to continue the pregnancy, and now they're coming late in gestation to have a second trimester procedure, which requires some additional skill and training. So how can we help with this? You know, how do women who are in Albany and in Syracuse and in all the little far reaches of the state get the same care as women can get here? We have to be able to train more providers. And I work in education. I train residents, I train medical students, teach them about abortion, contraception, access to care, why it's important, but it's not enough. And this law will allow us to expand care and coverage to the nurse practitioners who I work with side by side, to the PAs who we work with, and to certified nurse midwives, and people who feel comfortable, who already work in women's healthcare, who already know how to examine women, who have performed vaginal exams, who have performed pelvic exams, who know the anatomy, and who are quite capable of learning all the things that I teach to first-year doctors. So this law will allow us to expand this training. We know that our colleagues in California have had success with expanding access for patients, and so why should New York be any different? You know, should we be able to do less for the women of New York? I don't think so. Safe practice also means freedom from fear of prosecution by our antiquated laws, and so providers who would otherwise be willing to provide procedures or learn the procedure may be limited because they're afraid of what the law can do. And certainly in our practice, we may be limited even now because of the law and the hospital wanting to not have to be challenged by this criminal code. So I think that for us here, many of you all know all this information, or you feel maybe this is your first time, or you're watching online and you're sort of trying to get some inspiration to come and advocate. So what can you do? You can come to things like this, invite a friend. You can go and lobby and meet with the senator and the assembly member in their offices, and speak to them about this, as well as their colleagues who are not supportive. I've been to Albany a couple of times to speak to legislators, and it's a little scary at first, but you get your speech together, you get your lines together, you get your personal experiences. 1 in 3 women has had an abortion, so we know there's a whole bunch of people in here who have had abortions, and you can tell those stories should you feel comfortable about what your experience was, whether it was great, you had access, you got what you needed and done, which is the way it should be, or if you had challenges, as we've heard earlier. I hope that some of the information you've learned here today has sparked something in you. I hope that the tabling is useful and you can get some action activities out of you today, and I look forward to question and answer as we start it. Thank you very much.
So, first off, I want to thank everyone on the panel. They were all phenomenal. We are going to try to get through at least some of the questions, although there are way too many here. But I wanted to highlight quite a few of the questions. I was looking at them, and there's people asking, well, what can we do? Tell us what else to do. So I want to tell you that the organizations who are tabling here, when you go out of the auditorium to head home, they all have assignments for you. Good, constructive assignments about how you can get more active in getting the Reproductive Health Act passed in New York State. So some of them want you to sign pledges, some would like you to participate in lobby days in Albany, some would like you to work to get more information out in a variety of ways, some want to see if you might be able to volunteer with them, some want you to send postcards, some want you to go on visits to legislators, some want you to target specific legislators, some want you to phone bank. So there's many groups who are here with many different assignments you might be interested in taking on. all with the same goal, to get the Reproductive Health Act passed in New York State this year. I also just want to highlight that within a week, we'll be launching a new website for the Bipartisan Pro-Choice Legislative Caucus, and that we hope people will find it useful as a resource. So one of the questions was, do you ever talk together as legislators about how you can get things done, including with people who may not share your views? And the answer is yes. One of the things we have done in New York State is we started a bipartisan pro-choice legislative caucus. We have, I believe, over 90 members in the Assembly and the Senate. We've been trying very hard to keep it bipartisan. I think we have one Republican member at the moment from the Assembly, but we live in hope. Continually live in hope. But what's interesting for me, since I sort of came up with the idea for it and I'm a co-chair, the existence of the caucus has actually allowed legislators to come and ask private questions about things they don't know or understand. So I have many colleagues who won't sign on to the caucus membership, but they'll come and talk to me about questions and say, oh yeah, no, I agree with that completely. Or I might sign on to specific letters, but I can't be seen as being a member of the caucus. So there are constructive ways that you can have the conversations. And I love that Garin and Erika were discussing saying or thinking when they went to legislators who totally got it and their staffs got it, but we can't explain it to our constituents. Yeah, I'm a legislator. Just for the record, the constituents are usually smarter than us. We don't go home to stupid constituents, okay? So I don't ever buy that argument that constituents won't get it, because usually they're way ahead of where we are. No disrespect, Deborah or Joanne. Or any other legislators who might have snuck in. So, question that's, I suppose, the question for Katharine, although anyone else is welcome to it. Has the abortion-related provisions of the penal code in New York State ever been challenged as unconstitutional?
No, not in court. It's actually a strategy that is very much on our minds, but not until this point.
Okay. Thank you. Are there any language or strategies to suggest the pulling away the pro-choice curtain from IDC members? You reveal them more clearly to their voters. So yes, there are many groups throughout New York City and state now who have formed to challenge the IDC positions, to take on the arguments that they say they're all pro-choice, but they're not bringing or even pressuring John Flanagan to bring the bill to the floor. There were several questions here about what can people do to make the IDC do the right thing. So there's a number of answers. One, you can continue to pressure them to, even if they're not willing to come back, to make sure there's a Democratic leader of the Senate by giving their vote, in my opinion, to Andrea Stewart Cousins, the leader of the actual Democrats. You can vote them out of office. We run every 2 years. All right? You can even just threaten to run against them. That might be effective, depending on who they are. And there are groups who are working on all of these strategies. Someone's question was very sophisticated about, can't the IDC demand John Flanagan bring this bill to the floor? And that apparently they'd gone and asked Jeff Klein that question, and he said, well, we could, but it doesn't mean he's going to do it. So here's the thing. If they're not going to do it, then why the hell are they keeping John Flanagan as the leader of the New York State Senate, right? So yes, there are lots of different ways that one can put pressure on them. But again, it goes back to what I think Martha was talking about. Nobody's voting. And even in this nice blue state of New York, I don't want to walk down 12th Street anymore. There are 56 Trump voters. There are Trump voters all over. And we all have to get much more sophisticated in what we expect of our elected officials, holding them accountable, throw the bums out, and make sure that people are out there voting in the right people. Now, that's also one of the questions here. We have all these terrible judges the Trump administration is pushing through, and unfortunately, if the U.S. Senate isn't stopping the confirmations, it's very hard to do anything about it. So continue to fight for a progressive Democratic U.S. Senate, because some of these confirmations, not just in the courts, but I think critically in the courts, but in many of the agencies that we are completely dependent on, we have to stop these horrible people from ending up in positions of power, and certainly stop them from being on our courts for the next 30, 40 years, the long-term damage. Now, the question was, what about New York State courts? I don't know if anyone has surveyed if we have anti-choice judges in any significant number in New York. I'm looking at Katharine again.
The NYCLU has not done that survey, and I'm not familiar with that.
Okay. So I don't think that there has been a large number of cases that went through the New York courts badly because of anti-choice legislators, although Katharine did talk about the woman who was charged and found guilty of homicide. And so that was Long Island courts.
Yeah, and I mean, certainly we see all types of situations that come up in court, whether it's situations where a family court judge is deciding to remove parental rights, and all of the baggage that comes around that based on the behavior of the pregnant women. So, I mean, I think that we see this come up in a lot of different contexts, from family court to medical decision making, but it really centers around this these preconceived notions about how pregnant women should be behaving.
We also have had judges who have taken the right to life line when it existed, so that there clearly are anti-choice judges on the bench, but the reality is that there have not been lots of cases where they would have had a role.
Thank you. It's something I always talk about, that, you know, people say, well, it's not so bad to vote for someone if they take the anti-choice line or if they take the conservative party line. Here's the thing. Why would you vote for them? It just encourages them. Like, no, if they're taking those lines, don't let them in our elected positions. And we could have a whole other night on court reform and what we need to do to ensure that we have the qualified judges we should in the state. And there are a lot of disturbing stories out there, perhaps for another night, on judicial reform. So why can't we just put this issue on the ballot if you're not going to pass it through the legislature? Because we are not a referendum state. You can't just pick out something and put it on the ballot to vote it up or down the way you can in many states. In New York State, in order to get something on the ballot, you have to pass the issue through both houses, Senate and Assembly, twice in 2 different sessions of the legislature. If we could just get the Senate to pass RHA once, we'd be done. We don't want to have to go through 2 different houses in a 4-year period, then bring it to the public for a vote. There's a much easier way. A few more Democrats and a majority leader in the Senate. But people get confused between these referendum and initiative states and New York State. We don't have that option. How do we destigmatize abortion and activate voters and combat false narratives in creative and non-traditional ways? Because we're not sure the traditional methods are working. So I'm neither creative or non-traditional. So take it away, speakers. Martha, you're creative and non-traditional.
It's an excellent question, because I'm not sure that just being truthful isn't non-traditional enough. You know, I think, look, speaking just in terms of somebody who's in entertainment industry. We've seen an increase in certain, fictional abortion narratives in television and in film, and that's helpful and that's good. Shonda Rhimes is certainly not shy about telling these stories on her shows, which is great. But that's not really relevant here to what we're talking about. I think we need to be more honest about what we require of women when we talk about abortion or when they talk about abortion. We require them to be sad, guilty, lonely, mistaken, or even if they are truly sad, because in the case of someone whose pregnancy is very much wanted, there's an element of, as they were talking about, of shame about having this problem in the first place. I think we need to be honest about the fact that we don't need people to feel victimized and traumatized and cursed in order to exercise their right to take care of their own bodies the way they want to take care of them. That, to me, is non-traditional enough. To just talk about it in those terms is non-traditional enough. And I encourage people to do that. I mean, in our organization at AS4, we are very much about battling the stigma around abortion. We partner a lot with our friends at Shout Your Abortion, which is a fantastic organization that's very creative about this stuff. They've done, slide projection shows. I have a t-shirt that says, "Everyone knows I had an abortion." You can go on their website and you can order one of those. Removing the shame of this thing is critical, and being prepared and willing to talk about the fact that you've had an abortion and not needing to qualify it, and not needing to feel, not needing to make unintended pregnancy a consequence, a punishment for sex. Ideas like this. Those are some ways, possibly. Thank you.
We also had women who came up as the Handmaid's Tale, and they stood outside the Senate for several days, and I think doing various types of guerrilla theater, and while leafleting itself is not non-traditional, doing things that are more edgy are. And several years ago, I want to say maybe about 10 or 15 years ago, on another similar issue, it was around women's health and wellness, which was an earlier bill that dealt with access to contraceptives. How are we back here again? There were folks who handed out leaflets that said, "There are dinosaurs living on Long Island." And it got people's attention, but it had pictures of the various senators. They were very angry and very upset. So I think that kind of thing, and maybe doing some speak outs. I'm a kid of the 60s, so speak outs and teach-ins were sort of the bread and butter of the anti-war movement. And so I think some of that, as well as consciousness raising, which has gone out of, being conscious apparently has gone out of fashion. But those are ways in which people in their own communities and in their own ways can create energy, and, things that come out of the grassroots are actually quite fun and quite energizing. And these are some of the things that people can do. There were these great It's All Right to Be a Woman theater. Now I'm really dating myself, but that was in the early 70s. Lots of drumming was involved. And they did these different things that had to do with the stereotypes of women and knocking it down. So those kinds of I guess that's non-traditional.
Or like the 1 in 3 campaign, which is a great organization that encourages people to do storytelling events and theatrical storytelling events, not unlike sort of in the model of the vagina monologues, for example. They're terrific about that, and they do publishing, and that's wonderful. People telling their stories. Things like this. We have a friend, Nicole Schlesinger, who's done a series called Oral Fixation, which is her telling her story about having to terminate a wanted pregnancy and a late-term abortion that she had. And she tours the country, and we've sponsored her work doing that. But talking is number one. Talking is number one, and you can't get any much more boring than saying that. But that's just that's just a baseline. Just start talking. That's base.
Dr.
And
Sager,
doing it in places that are not expected. So talk to the folks at your temple or your church about setting something up, because that's where it's not expected.
Right. Dr. Sanger, did you have something?
Very quickly. Yes, I wanted to say that women don't think of themselves as being political actors often, but talking, to join the ranks of the boring thing to say again, talking is so important to just one other person. And it's you can use the analogy of how we got from homosexuality, as it was then called, being a crime and a mental illness, to a more progressive agenda by people, I'm queer, get used to it. And I did a math problem once. How many women, if there were about 1 million a year since 1973 having legal abortions, how many are there in America today? And my number was something like 48 million. And the other thing, you have to look for allies, a very strange, non-traditional place. I was reading the New York Times wedding vows section, and 4 years ago, an NBA player married his girlfriend from high school, and in their full-page wedding announcement in the style section, there's 2 paragraphs on the fact that she'd had an abortion with him during their college years. And I thought, Times is normalizing abortion. And then the next day, the blogosphere of pro-life exploded. The Times is normalizing abortion.
And I'll just also add that, and actually Eleanor's Legacy was one of the groups tabling here tonight, I would take a stab that if women's percentage in the general population, about 50 to 52%, was reflected in who were the legislators in our state and local governments, that we would probably have a much easier time about having these conversations and normalizing. So some of my male colleagues are some of my favorite colleagues, but there are just not enough women in Albany and in our local elected positions, and that would radically change, I believe, some of the discussion we're having. I did not get through all the questions, but it's 8:28, and I really want to make sure that all of us can get out there to the tables, sign up for anything and everything that you think's interesting. Remember that we're all going to be able to stay in touch with each other through the internet, because it's an amazing thing. And we can share our information, continue to come to meetings, continue to talk to each other and our legislators. And I just want to thank again this panel, phenomenal. I also want to thank my staff and Dawn Grisham from my staff, who helped put together this whole thing. And I think that's Dawn in the dark there along the wall. Yes, that's Dawn. So thank you, everyone. Get home safe.
Wonderful.